something we really have to ask ourselves, what are we doing wrong and what can we do to do better?
For me, prevention is the answer. All the patients that we've been talking about, the chronic illnesses, the diabetes, the hypertension, the heart attacks, these are patients that we constantly see in the emergency room all the time, day after day after day after day. For me, primary care physicians, where a patient knows who the doctor is, how to contact him, where they have annual physicals, where screening is done for diabetes, for high blood pressure, for cancer, nutritional consults, social services, and mental health screening. That's the answer. That's what we need to do here in the United States of America.
I'm going to ask my colleague, I want my colleagues washing the clothes, not me, and I'd like to invite you, Doctor, to make any closing comments you make, and then the Secretary, and the Secretary will close it out. But I want to thank you all for being here, and the one thing I've observed reading audiences over my career is that every time any of the experts in this panel spoke about the solutions and or the problems, I saw a lot of guys and women in white coats nodding their heads out there. So it seemed to me it wasn't just the docs that are sitting up here. So, and again, I want to thank you. I want to thank my closing comments. I want to thank you for Sinai hosting us here, for the great work you do. And with that, let me yield to Dr. Blumenthal and then the Secretary Sebelius and everyone.
Thank you, Mr. Vice President, and thanks to the panel. I'm the IT guy, so I think it's appropriate that I should end on an IT note. When we talk about prevention, one of the things that information technology, electronic health records really can do is remind physicians about needed preventive health services. And it is an unfortunate fact that even for insured people, not all physicians remember what they need to do for patients' indicated services. And there's plenty of information about preventive care for patients who get care for diabetes that isn't provided. So I think that's a big win from the information technology side. And I also want to end on a note that I think is especially appropriate in a facility like this with its incredibly dedicated staff. I think we will have the best healthcare system when professionals do everything they need and are truly committed to the things that need to happen. And I think of electronic health records ultimately as, in some ways, a key piece of the professional armamentarium. When we start to see electronic health records as essential to care as a stethoscope or an examining table or an x-ray suite, then the government will not need to be kickstarting the electronic health record movement. It'll be the profession that is pushing it along, and I think we're going to see that start very soon.
Thank you.
Well, again, Mr. Vice President, it's been a great discussion. I want to thank the experts here at the panel because you are doing the heavy lifting every day in the healthcare system, and what goes on at Mount Sinai can be maybe not quite as well, Ellen, but is replicated in various parts of the country, and we see it each and every day. I think the good news, for those of you who are not watching with intimate knowledge what exactly is being discussed in Congress, is that thanks to Congresswoman Schakowsky, who's played an enormously important leadership role in the House, and thanks to your senator, a lot of what is being discussed here that needs to happen is really a component of the health reform legislation as it's crafted. And investment in preventive health care not only was made in the Recovery Act, the first time ever a national investment in prevention is going to be launched by the Centers for Disease Control very shortly. But the health bills do contain a shift in the system toward, I'd like to say, have a great sickness care system. We don't have a great health care system yet in this country. We have great health care providers, but we need to make sure that at a much earlier point intervention is made, people have a health home, they get regular checkups. One of the most alarming statistics to me is that we have the first generation of American children today in the United States who, if the diabetes rate continues to grow, will have a shorter lifespan than their parents right now in America. That's not a great place to be in this country, and we can change that. So both the investments in preventive medicine, the investment in comparative effectiveness research, which I would agree is absolutely essential, and the kind of reform system to provide not only assurance to families who have coverage now, but to those who don't, that there is a way to get access in the healthcare system as part of what this congressional debate is about. And it's just a delight to be here today to thank the great health professionals here at Mount Sinai, but also to recognize that we're talking about life and death issues for citizens, 300 million citizens of this country, and it's important that this effort move forward, because as we've just described today, the status quo is unacceptable, and we can't continue down the path we're on. So thank you for what you do, and thanks for being part of this today.
Thank you.